having looked at all the biopsy techniques, how do we deal with benign tumors of the breast? Now, what are the benign tumors? As is shown in this slide, there is a fibroid, which I had mentioned earlier, is a benign lesion which need not be even treated if it is very small. Then there is what is known as a papilloma, which lies within the duct and is again very tiny, not felt to the hand, as shown in this slide again. These fibroids need to be tackled surgically sometimes if they keep growing in size. So suppose a lady comes to us with a small fibroid which is just 1 centimeter, we would not advise surgery for the fibroid. She would be on a follow-up maybe once in a year or once in even 2 years, and if we in our examination, in the subsequent examinations, we see that the tumor is growing in size, has from 1 jumped to 2 centimeters or 2.5 centimeters in a subsequent examination, and is reaching dimensions of about 3 centimeters, then this fibroid may need to be removed. And then how is it removed? It is removed as shown in this video by the needle of a vacuum assisted biopsy device. This biopsy device under local anesthesia is inserted in the tumor, and the computer guided excision of this whole mass is done under computer and ultrasound guidance, and the whole fibroid is completely removed without a scar under local anesthesia in the clinic without admission into any hospital as an OPD procedure, and at the end of the day it's a scarless procedure. No scar is left behind on the breast. So this is one of the ways of not only diagnosing but actually treating benign disease with the vacuum assisted biopsy device. The other indications where we would use a vacuum assisted biopsy device is in removal of the papilloma. A papilloma is a benign tumor of the breast which is present within the duct, can become cancerous if left alone, and this can be completely excised by the vacuum assisted biopsy device. A complex cyst, I had mentioned this during the diagnosis of lumps, that a cyst can be complex. That means within the cyst there is a solid lesion or a shadow of a solid tumor. These complex cysts can only be biopsied accurately with a vacuum assisted biopsy device, and therefore the vacuum assisted biopsy device is one of the most handy instruments, an important instrument in the overall management of breast tumors. This instrument has been with orchids, and we have pioneered the use of this all over the country, set up other units with WAB across the country since the last decade.